I'm Dr. Bhavna Bansal, HOD Surgical Pathology at Oncquest Laboratories. Today's topic is about LBC and HPV in cervical cancer screening. To start with, cervical cancer is the second leading cause of cancer death in Indian women, amounting to more than 1 lakh cases being diagnosed every year. Cervical cancer is caused by persistent infection with high-risk types of human papilloma virus like HPV 16 and 18. Mortality of cervical cancer is high, but the good news is that the cancer is preventable. Symptoms of cervical cancer are very vague. Women usually present with vaginal bleeding or vaginal discharge, and the main symptoms occur at an advanced stage of the disease. Therefore, screening methods are very important. Prevention strategies of cervical cancer include HPV vaccination and identification of precancerous lesions before they present as full-blown cervical cancer. So, here lies the importance of cervical cancer screening. When should the screening start? So, the guidelines of cervical screening are that the screening should start at 21 years of age. From 21 to 29 years of age, women are usually screened with a pap test, which can be repeated after 3 years, or an HPV test, which can be repeated after 5 years. From 30 to 65 years of age, women are screened by a pap test, a HPV test, and when both of these tests are done together, it is called co-testing, and it can be repeated after 5 years, and it is the preferred mode of screening. In women after 65 years of age, screening is only required if they have been diagnosed with an abnormal pap test in their life. Well-established screening tests for cervical cancer are pap test or LBC and HPV DNA testing. When these are done together, it is called co-testing. Pap test or LBC, it is the liquid-based cytology. It is a technique for collecting cytological samples on a smear or liquid vials through a Cervi brush, and these are done by a gynecologist. So when the sample reaches us, we have instruments for LBC testing, which are thin prep and easy prep, and in these instruments the test is performed and we get this sort of a button in case of a liquid-based cytology, and this sort of a smear in case of a conventional pap smear test. When these smears are stained, they are analyzed by a pathologist under microscope. Reporting is done according to standard guidelines known as Bethesda system, and we follow 2014 guidelines. The smears are reported as NILM, which is negative for intraepithelial lesion or malignancy, whether there is any epithelial cell abnormality in form of atypical cells or in situ malignancies or any glandular cell abnormalities. Very important to note that for co-testing, same sample in liquid-based cytology in that vial can be used for pap testing and HPV DNA testing. The importance of using LBC by easy prep method is that if the sample is taken in any of the vials and it reaches us, we can easily run it on an easy prep instrument. So not only easy prep vials, even if we have the sample in a thin prep or a sure path vial, we can run the sample and give an LBC reporting. LBC co-testing is superior to conventional pap smear testing because when the sample is taken in a liquid-based cytology vial, it can be used for co-testing. That is, it can be used for pap testing as well as for HPV DNA testing.